city authorities. We shall ensure that certain COVID-19 response plans against the threat of a third surge will include plans to maintain and sustain normal routine services in our hospitals so that the routine services do not suffer a decline. One example is that on Friday, the 23rd, Nigeria joined the rest of the world to celebrate World Malaria Day with the theme, Zero Malaria, Draw the Line Against Malaria. This was actually 2 days ahead of the real Malaria Day celebration, which is April 25th, which fell on a Sunday and was brought forward. Although Nigeria has successfully reduced our malaria prevalence in our country from 42% in 2010 to 23% in 2018, it is imperative that services such as that are not interrupted in the pandemic response, so that we do not suffer a decline, so that we also do not risk losing lives to non-COVID emergencies while paying too much attention to COVID-19 and neglecting others. That will not happen. I thank you all for your attention.
Victim Support Fund, gentlemen of the press, good evening. Good to see you again. Let me start by really thanking some of you that joined us for the World Malaria Day. So in addition to COVID, we have to keep our response going for all the other infectious disease threats that we face. Today, my briefing will be very short. I will focus very briefly on the COVID situation in Nigeria and the global threats that we face. So in the last 2 months, we have seen a continuous decline in cases in Nigeria, and this is a good thing. Most people get very worried when cases are increasing, rightly so. I get more worried when cases are decreasing because I know that there is a threat of resurgence, because we all naturally let down our guards, given the situation that we haven't yet been able to see our vaccination efforts the way we would have loved to. So we're facing a real challenge in terms of how to keep people aware of the risks that we face individually and collectively as a country. And we only have to look to India to see where they were a couple of months ago and where they are now, where they're reporting over 300,000 cases in a single day. And similar rises are actually happening in many other countries, in Brazil, Argentina, Turkey. So we must learn lessons from this and not wait to be in the middle of the situation ourselves. So this is a real reminder on the smartness of the virus that we're dealing with, its ability to mutate, to change, for new variants to emerge, which then drives increase in cases. The reality is that the introduction of measures such as travel bans, we are contemplating some of those at the moment. No decision has been taken, but none of that will be effective if we don't go back to some of the basics ourselves. COVID-19 is definitely more likely to transmit when we gather, when we don't wear masks. The importance of masks has become so much more understood now than in the beginning of the outbreak. So we must sustain these our efforts. It's very difficult. It's hard to say the same thing every week we come up here, But the reality is that if we look around our country, in our families, in our churches, in our congregations, we are just not doing what we need to do anymore, because we look at the numbers every day, we see them coming down, we think that the risk is over. And that is exactly what people thought in India 2 months ago, exactly what they thought. And now they are where they are. You can see the pictures on TV yourselves every night. So across the country, all of us have resumed our large gatherings, weddings, parties, markets. Barely do you see anyone wearing a mask. Hand washing booths have disappeared. People have gone back to business as usual. So really, if there's only one thing I want to say today is please appeal to all of us to come back to where we used to be for just a bit longer. The price that we could potentially pay will be incredible if we lose the very fragile gains that we have had. Please, this pandemic is not over. It is not over. I'm really appealing to all Nigerians to keep these measures in place. The pre- and post-travel testing for people returning are very important. And these people that come back and don't adhere to the quarantine restrictions of staying at home are members of our families. And when they go out after returning, we keep quiet about it. So it's part of our responsibility to hold ourselves, our colleagues, our brothers, sisters, responsible for their actions when they come back from travel, and insist that they don't go around mixing until they have stayed and tested and turned out negative and gone back. We have several new tools that we're using. One of the most important ones are the Antigen-Based rapid diagnostic test kits. We're trying to deploy this into everywhere people gather, large workplaces, schools, camps, hospitals, and we have used this critically in National Youth Service camps, and today we'll have a donation you'll hear about very soon from the Victim Support Fund that will enable us continue to use this in subsequent groups of NYC camps that will continue to happen over the next few months. So with all these tools, we have to implement them diligently. So also today, really to appeal to state governments across the country to reinvigorate your response. Please don't drop the ball. Work with us. We're there to work with you. Also appealing to the media, please keep airing those messages you've been airing over the past year. Don't take them off your screen just yet. Keep those messages live. This is not over. So there are still very many difficult decisions to be made. There's a lot more that we can do as individuals across the country to keep the momentum. Unfortunately, we have to. We really don't have a choice. If not, we'll get back to where we were. So to start concluding, in recent weeks, in addition to the actual response to the COVID pandemic, we have been building up our health security architecture across the country to make sure we're better prepared and better have the resilience to respond if we need to. 2 weeks ago, I was privileged to be in Owerri with the Honorable Minister of State for Health, Senator Mamora. We opened a brand new treatment center in FMC Owerri with an adjunct lab. We've been doing this in many centers across the country, building up our infrastructure so that when we do have cases, not only of COVID, but any other infectious disease, we're better able to respond, better able to accommodate our patients. We're also in Bayelsa with the Honorable Minister for Health last week for a health summit, which included a whole new thinking around health security in Bayelsa. So I'm excited that many state governments are now taking the challenge of actually redesigning their own capabilities so that they prevent the lockdown that happened. We have started a new intermediate field epidemiology training program and a new public health emergency management program. So building the people, the human resources that we need to keep Nigeria safe now and for the long term. So finally, pandemic fatigue is not unexpected, but we must not forget that where we're coming from and where some other countries are at the moment. We cannot afford another large outbreak in Nigeria. So please take responsibility, adhere to these things. It's difficult, it's tiring. We want to get back to life as usual, but we just can't. My brother, the ED of NTA CDA, will just update all of us on vaccination rollout efforts. We have a supply challenge. We're working very hard to solve that, but until we get our coverage higher and get everyone with 2 shots of the vaccine or 1 shot of the Johnson & Johnson when we get it, we just can't afford to let down our guard. So please, Nigerians, work with us. Let's keep this going for a while longer to keep the country safe. Thank you.
The chairman of the task force and secretary of the government of the Federation, honorable ministers here present, permanent secretaries, director generals, the DG of NYC, ladies and gentlemen, good evening, and I'm delighted to be here to interact with you once again, and I appreciate the great work you're doing to support the government in its collective fight against COVID-19. In our sustained efforts to contain the threat of COVID-19 pandemic and protect citizens, the federal government, through the National Primary Development Agency, under the guidance of the Presidential Steering Committee and the Federal Ministry of Health, has continued to implement several preventive measures in order to save lives. The vaccination against COVID-19 is currently ongoing in all states of the Federation. Our collaboration with health officials and other stakeholders at the national, state, local government, and community levels in the vaccination exercise has yielded substantial results. I am pleased to inform you that as at April 1,173,869 Nigerians, representing 58.3% of the eligible persons targeted in this current phase, have received their first dose of the AstraZeneca vaccine. Notwithstanding the above successes, we are aware of the global scarcity of COVID-19 vaccines due to high demand, especially in countries where the vaccines are being produced. We therefore anticipate a delay in vaccine supply to Nigeria, which may also affect and impact the remaining phases of the vaccination campaign. However, in response to the anticipated delay, the federal government has rationalized the vaccination exercise by preserving 50% of the available doses of the vaccines for administration of the second doses. Each state of the Federation, including the FCT, are currently administering only 50% of their allocated doses of the vaccines. The remaining 50% will be administered to clients who had earlier received the first dose, and this will be scheduled between 8 to 12 weeks from the date of the first dose. Data from this exercise are being uploaded and updated by states on the electronic management platform. Furthermore, the federal government has signed off to receive up to 29.8 million doses of the Johnson & Johnson COVID-19 vaccine through the African Union platform. We are also expecting deliveries of vaccines through the COVAX facility by the end of May or early June 2021. By this time, we would have completed the process of administering the second doses of AstraZeneca vaccine to those who got the first dose. In the meantime, NAFDAC is continuing discussions with manufacturers and examining their vaccines in anticipation of the emergency use listing from the World Health Organization. We hope that these will mitigate the negative concerns about the delayed deliveries of AstraZeneca vaccines, thereby ensuring the sustained supply of vaccines for smooth and continued vaccination exercise. To further strengthen vaccine security and accountability, we are deepening our collaboration with the Independent Corrupt Practices and Other Related Offenses Commission, ICPC, and the Economic and Financial Crimes Commission, EFCC. Our partnership in this regard is also aimed at further curbing cases of vaccine mismanagement and other anticipated sharp practices at the vaccination sites. The agency has taken delivery of 2,250 tablets as donation from CACOVID to help health facilities with the registration process and making it less cumbersome for data capture in our electronic data register. We therefore encourage all eligible residents of Nigeria to continue to register for vaccination through the NPHCDA website, and we guarantee that every registered person will be scheduled and vaccinated in the coming phases of the exercise accordingly. Let me state from available scientific records and investigations by the World Health Organization and the European Medicine Agency that the Oxford AstraZeneca vaccine, among others, is safe and efficacious. Our national regulatory body, NAFDAC, has also certified that the vaccine is safe and strongly recommends its continued use for all eligible age groups. May I also reiterate that we shall continue to collaborate with the NAFDAC pharmacovigilance team to monitor the administration of the vaccine and document any adverse reactions following the vaccination with COVID-19 vaccine. We believe this will further assure Nigerians that the government has made a safe choice of vaccine for protecting our people against COVID-19. Having provided the above information, I will also supplement with the fact that we have documented adverse events following immunizations. There have been 8,711 cases of mild AEFIs, while there have been 52 instances of moderate to severe AEFIs. Kaduna, Cross River, Yobe, Kebbi, and Lagos continue to lead other states in terms of the numbers of AEFI cases. In furtherance of our sensitization and mobilization efforts for successful COVID-19 vaccination campaign, NPHCDA, in collaboration with the Presidential Steering Committee, the National Orientation Agency, development partners, and other stakeholders, is conducting town hall meetings in all 6 geopolitical zones to address public concerns and hesitancy on the COVID-19 vaccine and vaccination in general. We have so far successfully staged the North Central Zonal Town Hall meeting in Lafia, which was hosted by the Nasarawa State Government. The event is scheduled to be replicated in the remaining zones in the weeks ahead. During the recent town hall meeting, health experts took turns to further educate and sensitize Nigerians on the benefit of vaccination as a means of protecting themselves, their families, and their communities. And this will ultimately facilitate the return of our communities to social and economic normalcy. Gentlemen of the press, I will therefore enjoin you to prioritize the sensitization and education of the general public on the benefits of the COVID-19 vaccines through your media for attainment of success in the COVID-19 vaccination campaign and other public health interventions. It is evident that our collective efforts to protect Nigerians against COVID-19 is so far yielding positive results, and we must sustain the momentum in order to achieve our desired goal of a healthy citizenry. Thank you immensely once again for your time and attention.
Mr. Chairman and Secretary to the Government of the Federation, Honorable Minister, Honorable Ministers, Director Generals, ladies and gentlemen of the press, good evening. I will be brief in my remarks today. First of all, I will talk about the gradual reopening of the economy. We have continued with this, And in the last few weeks, we have recommenced international flights in Kano, Port Harcourt, and Enugu. We're in preparation to commence Port Harcourt tomorrow and probably Enugu later in the month. It is important to note that while we are opening these international flights, there is also a risk, that is the risk of importation of additional cases into the country. We have to balance the economy with also our public health. This calls for increased vigilance on our side from the Federal Ministry of Health, the Port Health Authority, the state government, public health departments, and the Nigeria Centers for Disease Control to continue to man our borders and ensure that people that come into this country are either COVID negative or they are safe to pass into our communities. The state governments have been of tremendous assistance. They have all collaborated with us, particularly the government of Kano State, the government of Rivers State, and also the government of Enugu State. They are providing quarantine facility, which will be used for passengers who do not comply to this protocol. And they are also providing additional security as well as logistics for transport of conveying passengers from the airport to the quarantine facility. The state governments are also providing additional staff, since we do not have enough staff at the borders or in these airports to provide the necessary health services. And the state governments are also doing many other things to support these services. The state ministries of health are also collaborating with us to ensure that we track people who come into the country, to ensure that they remain in self-isolation, and they also conduct their tests on day 7. While we continue to reopen the economy, we must also be aware of the happenings around the globe. Mr. Chairman and Honorable Minister of Health have made reference to specific incidences in India, Turkey, Brazil, and also South Africa. These we are taking with serious concern, and we continue to monitor what is going on in these countries. We sympathize with the people of these countries because it is really a very trying time, particularly for India, that is recording over 300,000 cases a day and recording over 2,000 deaths. It is not easy. India is a prime destination for medical tourism for Nigeria. We know that many Nigerians like to travel to go to India, but now we see the situation that the country has found itself in. While we urge Nigerians to limit all travels to only essential travel, particularly to these affected countries, we will continue to urge Nigerians to also comply with public health measures that are put in place and to continue to ensure that we comply with the regulation. We are now, for the Muslim Ummah, we are in the month of Ramadan, and very soon we will commence Salah celebration. Let us remember that COVID-19 is still here with us, and we have to take all the necessary precautions to ensure that we remain safe and we also protect our loved ones. We must continue to use face masks in public places. We must continue to ensure that we avoid overcrowding in areas. As a reminder, let us also know that our guidelines regarding public spaces still apply. Owners of public places such as supermarkets, malls, event centers are also enjoined to adhere to this compliance. Enforcement will continue to be observed, and will continue to monitor these places for violations. We're not saying this just for saying but it is important, looking at what is going on around the globe, to ensure that we protect our country. The fact that the number of cases in this country are not rising does not mean that we are immune or we are completely protected against COVID-19. The third wave, the way we see it going on now, it's only a matter of time. It is not a matter of if, but really a matter of when it is going to occur. And therefore, these measures that have been outlined, we must continue to ensure that we comply and make sure that we protect our public and our communities. I urge the state governments to continue to show ownership by demonstrating increased testing, supporting staff, and also ensuring that isolation facilities are in place. ICU centers have been set up across the country. It is our duty and responsibility to ensure that we maintain these facilities as functional as we can. In the area of staffing, we must continue training of medical officers, other health workers, to ensure that when the need arises, maintain a database so that when the need arises, we're able to utilize them effectively. Finally, I want to thank the media for all the work that you've been doing in providing the necessary communication and educating Nigerians on the need to ensure compliance to these directives. Thank you very much.
We thank you, the head of Secretariat, for that report. Let us run a report from the DG NTA, Captain Musadhu.
The Chairman, Presidential Task Force, honorable members, and other members of PTF, ladies and gentlemen, good evening. A very short brief on aviation this evening. As regards to the issue of Emirates Airlines flights, resumption of their flights to Nigeria, the Presidential Steering Committee deliberated extensively on this matter, and the gap has been significantly closed between the position of Nigeria and UAE. They've actually met some of our requirements, and we're just waiting for one confirmation. And very shortly, an announcement will be made on the outcome. Very shortly, hopefully within the next 48 hours, we'll make an announcement on that. The second issue is in the opening of more airports in Nigeria for international flights. 3 airports, Kano, Port Harcourt, and Enugu, were cleared by PTF to resume international flights. Kano has resumed. Port Harcourt is almost there. Just a few things to close there. In the next couple of days, we expect Port Harcourt to be released for the resumption of international flights. Hopefully in a couple of weeks, Enugu, Akanu International Airport, Enugu will join the list, making it a total of 5 international airports, all the 5 international airports in Nigeria resuming international operations. Thank you.
We thank you too, DG NTA. If you've noticed one thing, almost all the speakers today have commended gentlemen of the press for reporting rightly on the activities of the Presidential Steering Committee. For this reason, the time has arrived for us to take your questions, gentlemen. So I now invite Amaka from Arise.
The Chairman, members of the PSC, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually goes to both the DG of the NCAA as well as the National Incident Manager. It has to do with this advice that was released just this morning by the Academic of Medicine Specialists in Nigeria, actually advising that we should consider banning flights from these high-burden areas, especially India. But we do know that there's no direct flight from India into Nigeria. Yes, I have heard you say that there's some things in the works, but What exactly are we planning? Are we looking at this advice, especially looking at the high numbers coming out of these countries? Would need some answers on that today. And my next question actually goes to the DG of the NCDC, Dr. Chikwe Ehekwazu. Well, you talked about the fact that you're worried about this low number, but you didn't give us a particular reason as to why this is happening. What is responsible? Is it that we're not getting the samples into the labs, or what is going on? Why are we seeing these low numbers, even though that we know that transmission is still high, especially at the community level? And the next question goes to the primary health care, Dr. Faisal Shuaib. Well, you have talked about the fact that there is that advice for states not to exceed 50%, but I can tell you, some of them have actually given out more than 50% of their doses. So how do you intend to augment, the second doses for those states that have given beyond, the first dose? And since we're having this issues of supply shortage, especially looking at what's going on in India, and they're not supplying even COVAX or even other countries that are looking to purchase. Thank you.
Good evening, Mr. Chairman,